All right, for the sake of the video, I have to have your permission that it's okay to film you and interview.
Yes.
Okay. So this is Angela Myers. She's going to be working in the medical field and she's going to be conducting the interview with Sade Wilson. So what made you decide to get in the medical field?
Well, ever since I was young, I always wanted to help people, and I kind of like shied away from it. And as I got older, I knew it was something that I wanted to do. So, and then I have family members also as well that have health issues. So I said, you know what, it's something I probably want to look into so I can help up not only others but my family members as well. So it was just something dear to my heart.
And did you have another field in mind or anything in interest before you decided to go into medicine?
Yeah, actually, I went in school for communications. I want to be the weather commentator. I love maps. I love looking at geographic, atmospheres, things like that. So, yeah, I had an undergrad in communications. So,
Wow. And where did you attend school to be in this?
in the communications, I went to Edward Waters College in Jacksonville, Florida. And then I did my medical assistance at Southern Technical in Armidale, Florida.
All right. And what's a typical workday like, just any day?
In the medical field, it's really nothing typical. It's always something different every day. You just never know what to expect. But for the most part, you're always greeting and working up patients as far as getting their blood pressure, temperature, depends on their symptoms, what they come in for, vitals, the oxygen, or heart rate. And you ask them a bunch of questions. That's a typical day. You deal with the patients, and then you may administer medicine that the doctors prescribe for the patient.
Okay, and doing your job, do you have to work under a lot of pressure when you're working? Like, do you feel pressure working during the day, or is it just kind of smooth and easy?
It depends. Sometimes we're double booked, meaning that we may have 4 or 5 people in an 8 o'clock time frame, and the patients get a little antsy. They got somewhere to be or this and that, so you kind of feel a little pressured. But other than that, no, because you have to take control of the room, the office per se, and let them know that if you want to get a good checkup and let the doctor really look at you and determine what's wrong with you, you got to have a little patience. So give yourself an extra 30 minutes. So, but other than that, not that bad.
And is there any take-home work, or is like once you leave the office, like that's it, you just come home and it's no work at all?
Well, my head nurse, the office that I work for, she always says leave it at the office. So no, we try not to. I try not to. Sometimes it's hard, depends on the patient, and you get a little, because sometimes you see the patients on a regular basis because they come every 1 week, every 2 weeks, and you see them a lot, so you get attached to them. But other than that, no paperwork or nothing like that. So you just try not to bring the feelings and emotions that you get attached with the patient with home. But other than that, no.
Well, that sounds nice. I wish every job was like that.
I know.
And is there any like professional development opportunities? Like, can you move up in this career job that you're doing, or is it just you stuck in that station?
Oh, most definitely there's room for advancement. It depends on how far you want to take your education in the medical field. I chose medical assistant, and I could go back to school for my nursing degree. I can go back to be a physician to the doctor, or I can go back to be a doctor myself, physician. So yeah, there's a lot of room for advancement because there's so many different areas in the medical field. So most definitely.
And do you think this is a secure field? Like, once you're in it, you're in it. You're not gonna be like laid off or anything. Like, you can depend on this job, like as a big life career. Like, you're just gonna be set.
Well, I believe that nothing's 100% secure these days. You never know. But I also know that the health field is probably going to be here to stay because people are going to always need to be taken care of, or something's going to be wrong with them where they're going to need a professional in the medical field, as myself or a doctor or what have you, to see about them. So, yes, it's going to be something that's going to be long term.
Okay. And does this job give you a challenge to keep you interested in the medical field?
Yes, that's one of the reasons why I chose it, because I knew it had a lot of avenues. Because nowadays, well, I'll say this, I'm like not young, but I'm not old, but I'm old enough to know that a few years, maybe 10 years back, you didn't have as many different avenues of the medical field. You can go for your head to your toe for just specific specialties of doctors they may be in, like say orthodontist for your joints, you know, and then you have your cardiologist for your heart. So it's different areas. So yes, like mainstream as far as that go, yes.
Okay, and the last question of the day. I'm a type of person who needs energy and activity and different things going on within my day. Do you think this job would be something that's like personally good for me to start doing or getting
Oh
into?
yes, it depends on what avenue you go. As far as specialty, it's gonna always be something to do. It's gonna be fast paced, and you're gonna have to be on your tippy toe sometimes. And like I said, you may get a patient that come in there with this weird symptom or something. You may have to do something totally different that you're not used to doing, and you're on to the next patient. So it depends on how. Well, also I'll say too, we have one doctor. For example, I have one doctor in my office. But if you have several doctors and you're that nurse that day, you may be doing all type of things, drawing blood, um, doing an EKG somewhere else, and then you jump in the back doing maybe a CAT scan. It depends on the office itself. So you will be picking the right field.
I want to say thank you for conducting this interview with
anything
me.
for you.
Thank you.
Thank you.